everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Coach and our supplements to support people diagnosed with chronic kidney disease, Kygenesis. And I'm so excited to be joined again today by the beautiful Stephanie MoDavis. Stephanie is a huge part of the Kidney Coach team. She's come on as one of our coaches, but she really works in the area of mental, emotional wellbeing resilience. She's a yoga instructor. She's worked in the hospital system with people going through dialysis and transplant and knows that mechanism and seen inside and out, having had her own journey and going through 2 transplants herself, as well as dialysis, and coming out the other side and really thriving and finding her life purpose in really supporting people diagnosed with chronic kidney disease. Stephanie has such a unique insight into the medical system and what it's like to really get through a transplant and dialysis and come out the other end and thrive and be able to have it, rather than define you in a negative way, shine light and really escalate you into life's purpose and what she's doing now, which is supporting people going through similar journeys. So Stephanie, thank you for being you and everything that you bring to the world. You are a gift.
Oh, thank you. That was so kind. And it's always a pleasure to be here. Holistic kidney process was something I needed so desperately when I was starting my journey. Thankfully, I had some experience teaching yoga and with some mindfulness and some Eastern practices, but I'm so glad that you guys offer what you're doing out into the world because it's so desperately needed. So thank you.
Our absolute pleasure. So Stephanie often emails me, you know, she's so thoughtful. She will email me a couple of days before and she's like, I really think we should talk about this. And I was like, I love it. Yes, let's do it. So we are going to talk about the stress response and how to navigate stress. But I love that the flavor that we're going to talk about is really the difference between how men and women process stress, which I think is such a great topic if people have been diagnosed with a chronic disease, and how men might go through it and express or not express themselves versus women, and how we can support our partners and the people around us that may be diagnosed with any chronic disease as well as chronic kidney disease, and maybe the nuances. So if you're in the community and you know someone, or you yourself or a partner, how stress may be being verbalized or non-verbalized in some cases, and how we can tune into that. So I'm just going to hand it over to you, Stephanie, and if I have any questions, I will let you know, but take it away. Tell me.
I think that it's very normal that we understand that stress is a big part of modern society. In fact, in our last presentation, we talked about that quite a bit. But what I didn't realize as a 19, 20-year-old being diagnosed with kidney disease and autoimmune disease was I didn't even really understand my own stress response. It was just happening. And I just thought, well, this is how I am. And people would tell me, well, it's normal to be stressed when you're going through this. But the actual self-awareness I had around my expressions of stress, whether I shut down or how I tried to navigate or cope or repair, I was totally in the dark. Now that I'm older, I have a bit of awareness basically from my experience, and I've educated myself. But I'm so grateful that we're going to talk about this today, because not only does it hit on developing some self-awareness around our own stress response as either a man or a woman, but it also gently touches on this idea of relationships. And if somebody that has kidney disease is in relationships, which we're all in relationship, whether it be with a partner or our children or our team, this just really opens up another dimension of how do I not just deal with my own stress responses, but how can I best navigate when someone else that I love may be going through some pretty big stress responses.
I love that.
Yeah, so we'll just start just with some basic information. So in 2024, stress in American adults has risen, with 43% more feeling anxious than in 2023. That's a pretty big rise just in 1 year. Global uncertainty, economic uncertainties, concerns contribute to this increase, with 70% of adults anxious about current events. So add on an illness on top of everything going on, this exasperates it 63%, right? Wow. So it is something that you have to really wrap your head around it for a moment, is that normal, quote unquote, normal people have an incredible amount of stress. yet alone if you're dealing with something like a potentially life-threatening illness, it can just be totally overwhelming, which I know I've experienced. So here we go. I'm going to get right into it, Fiona. There is men and women we're different with how we deal with our stress responses. And again, if anyone is watching this, they might realize, oh, well, yeah, well, my husband does this when he's stressed, and I do this when I'm stressed. But I just want to have a little bit of an outline here for everybody. So we manage it differently. We can expect our partners to manage stress the way we do, and we can't expect them to read our minds. That was something that was really important for me when I was going through my stress. I just somehow assumed that people knew how I felt. So understanding how you deal with stress and not being afraid to really just tell people, hey, when I'm really stressed, I might do this, just so you're aware. Communication is not a bad thing. Also, when we're informed, we can start to empower our process with navigating kidney disease. I can't tell you, I've told you already several times, I was winging everything with my kidney disease at first. And it's really good to have informed consent on many levels and really understand and start to empower yourself, not just around what we physically and biologically have to do, but also the multi-layers of who we are, which is emotional, mental, etc. So this information applies, it's actually life information. It just is extra helpful when you have an illness. Self-awareness is pivotal, not only with dealing with our illness, but in our life period. And I think that somehow we've gotten through the majority of our life just making the statement, well, this is how I am, or I am this way because of this. But how many of us have really dove into our life and started to really create self-awareness around our behaviors and why we do what we do? And actually, on a core level, who really are we? And when you're going through something like kidney disease, I experienced that if I'm not doing something, either I would be distracting myself or be extra stressed or emotional or depressed if I didn't have something that was somewhat informational or positive to focus on. So I think that learning how to develop self-awareness and doing some introspection and really starting to learn about yourself while you can't physically do too much is a great time for you to start doing that. And then on the right here, I just want to start to get into this a little more. Men and women have hormonal differences. I don't need to tell this to you, Fiona. You probably already know all this information.
No, it's so good. People just seem to forget this sort of stuff. So it's great that you're going over it.
It's a good reminder. Women tend and befriend very often when they're stressed. That's their natural tendency. Not every woman does that, depending on other things going on within their life. And men tend to escape or even can get aggressive back if you're really pushing them when they're under stress. So that's good to know. So as I said before, self-awareness, do you even know your own stress responses? Again, starting to bring conscious awareness as we are adults now into really trying to understand more why we do what we do. So I just wrote here, gaining self-awareness about our stress responses enables us to identify triggers and patterns, maybe even before they're happening or while they're happening, so you can repair better. And it allows us to adopt preventative measures and develop effective coping strategies tailored to our own personal needs. This understanding empowers us, which when you have a critical life-threatening circumstance such as kidney disease, anything that can empower you is helpful, because you feel so out of control and you feel at the mercy of, you're not quite sure exactly what's going on. So when you can develop this empowerment, it's very powerful. So it fosters resilience, as we've talked about, and promotes emotional well-being, both in ourselves and in our relationships when we start to become self-aware. I like this little quote: stress is not what happens to us, it's our response to what happens. And our response is something that we can choose.
Such a statement that people forget, because people go through the world reacting. And this is something, I've got it in a post-it note stuck in the fridge over there, because it is, I may not have control over situations, but I've always got control over how I decide to respond and react to it. So it's great that you've brought that awareness.
I think a side note here, real quick, is that if you have not yet dove into self-awareness around your own stress responses and some emotions and some of that deeper inner work, it is normalized, even in adulthood, to just emotionally fill up and react. Like, we can act very childish sometimes. We just, and it's normalized in society very often, and obviously nobody's perfect, right? We have times where we're just overwhelmed, we lose ourselves. But when you do this work, it's just miraculous how so often you start to realize, oh my goodness, if I hadn't done what I had done, I would have reacted in this situation completely different. I would have destroyed this relationship. I would have destroyed my relationship with my boss. So you really start to realize and become conscious of your communication, which is, I think, really helpful.
Yeah, totally agree.
Yeah. So just a little bit of historical context about just men, women, science, and health and illness is that pre-1980s, most scientific health studies focused on men's constitution. I feel like we may have mentioned this before, but we're starting to learn now, and I'm doing some researching, that not only do we have hormonal systems that are very different, but I forget who the author was, the scientist who was saying that they're starting to discover that an entire biological anatomy and physiology actually works slightly different than men's. We may have similar parts, but they're really coming to realize that there's not just subtle nuances in men and women or brain functioning or hormones, that actually it's profoundly vaster than that. So that's something to be aware of as well. There was a shift in the 80s, recognizing the gender differences in health and stress responses. And again, as I mentioned, they're doing a lot of ongoing specific studies to understand what really is women's health, and have we done women a little bit of a disservice by not really focusing on our constitutions as being as uniquely different than men's as maybe they are.
Yeah.
So an easy one to start with is the brain differences, right? So there's a philosophy, an ideology it's somewhat been debunked, but it's very complex, and it does apply in certain cases where we can just look at the brain hemispheres and say the right side of the brain would be the feminine perspective, which is the creative and the nonlinear and the nurturing and compassionate and emotional, and the left side of the brain being this logical, analytical, linear, very masculine type of energy responses. I guess they're learning more that it is a bit more interconnected than that, but there are very stark differences between men's and women's brain, especially when processed stress. So as I mentioned earlier, with men, increased stress activity activates their prefrontal cortex and their amygdala, and they often go into this kind of fight or flight mode right away. It's like, what do I have to do? It's like they just immediately get ready to solve a problem. They compartmentalize their stress response more. This is a communication pattern, Fiona. I don't know if you've experienced this, but men are very good at compartmentalizing things.
Oh, yes, they are.
And to a woman, can be frustrating, and it can almost, we can misinterpret that somehow they don't care. But women's brains, we have increased activity in the limbic area, which is more of the emotional area when we're stressed. And our stress is more integrated across the brain regions. So I was speaking to a man once, and we were in a heated debate. And very intuitively, it's kind of funny, very intuitively, he said, well, what do you think we need here? And I said, well, I think that you need a bigger corpus callosum, which is that centerpiece of the brain that connects the two hemispheres. And lo and behold, I came to find out that women do have a bigger corpus callosum, and that allows for just a more widespread interconnection between those compartments that the men have. So I kind of see it as men often think in little boxes. They have lots of little boxes, and women's brains are connecting all of the little boxes.
Interesting.
It's really important just to, assimilate that information.
Yeah.
Right? It's kind of cool.
Yeah.
So there's some biological differences, obviously, when men are stressed and when women are stressed. The male stress response, as I mentioned, is that fight or flight. There's a predominant cortisol increase and adrenaline increase. And then the physiological changes would be increased heart rate and blood pressure. Like immediately they jump up and they get ready to go. Female stress response, as I mentioned earlier, tend to befriend. There's additional hormone. They need to balance out their oxytocin when women get stressed. It starts to deplete. And then physiological changes, lower cortisol levels and lower blood pressure. So it's almost opposite. It's so strange. One of the nuances that I do want to bring up is, and we talked about this in one of our last episodes too, was that because of the way culture has conditioned men and women over the last 50 to 70 years, where more hyperdependence in women, the feminist movement of we can do everything that a man can do, actually this has changed some of our natural responses. So if you have a woman who is a worker bee, and she's expending a lot of her hormones at work, she can actually start to become a little more dominant, like a man's energy would do. And it's harder when a woman is under exceptional stress and she's doing more man's work and really pushing herself to return back to her feminine energy. And I think that that's something culturally that we're starting to see a little bit, is that there's a lot of narratives around how can we support women to return to their soft energy, where they feel seen and loved and supported, not where they're so stressed and anxious and depressed because they're running so high all the time, and they're not finding that softness because we're just doing so much. And that then also affects the masculine energy when she's super dominant, because she's very stressed and she feels very unsupported, and she's not balancing her oxytocin by being with her friends and having some downtime to talk. She can do things like a man would do, which like, oh, I'm hiding, I'm running away. So it's just something interesting to think about is, what is your dominant energy as a male and a female? Like, do you find it hard as a female to reconnect with being soft and relaxed? Do you find that you're always running really high and you just have a hard time settling down? The proclivity would be a lot more stress and anxiety and even things like depression. And same with a man. Where is he at? What is his natural tendency leaning towards? So it's kind of interesting. There's my fireman.
I
So
love
that's
it.
what I think of with a man, like he wants to engage in a fight or flight behavior when he's stressed, right? Again, sometimes a man can also shut down, which I have here as well, but men also may retreat. They just need space. That's why when I was married, early on in my marriage, a beautiful woman who was a mentor to me said, okay, Stephanie, when your husband comes home from work, don't say anything for 1 hour. Don't bombard him when he gets home from work, because when he's at work, he's utilizing up that testosterone being at work, doing his man stuff. When he comes home, the man needs to rest a little bit to build back up his testosterone to feel like he's in his comfortable masculine energy. So sometimes when we bombard men because, women want to talk and connect when the man comes home and they're not in the right space, they can become a little argumentative or then like retreat to the man cave for a while. You know what I mean?
Yeah.
And then again, women likely to seek more social support. That's the natural thing. That is the natural flow of, if a woman is very overwhelmed, let me get on the phone and call my friend. Let me talk it out with somebody that I feel safe with. Let's go grab some coffee and just be with another woman and work through that emotional processing with another woman. I've heard and I've read that, men don't necessarily love to do the emotional thing all the time, but women really do. That's how we really process our stress and our information.
Yeah.
Right. So yeah, we tend to use emotionally focused coping strategies, and there's a higher likelihood of reporting physical symptoms of stress. And I wanted to mention this because I've been seeing this a lot, Fiona. I don't know if you've seen anything about this, but because of the overwhelming loss of control and stress around the COVID response, that I had heard from some psychologists that they were saying to prepare for a large psychosomatic kind of illness increase, because that stress, that overwhelming long-term stress, especially for women or sensitive souls, really starts to create physical symptoms. I don't know about you, but whenever I'm stressed, I feel it physically. It's like my mind and my body aren't really that connected. They're not disconnected. For me, it's very obvious when I'm overwhelmed. I get a headache, my shoulders get stiff, I feel a little tight, like my stomach may not really digest the best if I'm really stressed. So I immediately have a physical symptom with my stress very often. So that's something to look at and to be aware of, is that, you know, women can be we express through our body very often
Yeah.
our stress.
Yeah.
You
Yeah,
know?
no, I haven't maybe not seen so much of the psychosomatic stuff, but that's interesting. I'll bank that in the back of my brain.
Yeah, I'll have to send you some stuff to,
Yeah, I'd have to
some
have a
of the
look.
things I'm seeing. The other thing, kind of sort of related to the psychosomatic, is what now medicine calls medically unexplained. And
Mm,
that's on the increase like crazy. It's like something's wrong with me. And you go into the ER, you think you're dying, and they're like, nothing's wrong with you. And they're saying that this could be related. It's like
yeah.
this over stress response that's manifesting physically, and you think something's wrong because it really truly feels like something's wrong with you, but then medically they're not finding anything.
Mhm.
You know, kind of interesting.
Yeah, yeah.
Yeah. So impacts of illness on stress response. So again, it's going to increase everything when you're ill. So women report higher levels of stress just generally overall. I don't know if that's because we're more honest, we feel safer to be more communicative.
Yeah.
Not quite sure, but that would seem like that may be part of it. And we're more likely to experience stress-related physical symptoms, as I said, headaches, digestive issues, all kind of interconnected. And I see this a lot in the world of autoimmune as well too. It's like there's like several moving parts happening, you know. And then men, sadly, I hope this is getting a little better, but they're less likely to report stress or really seek help. And I know this has been like a really huge problem, and I'm sure you have some feedback on that. Um, but it seems it's difficult to get men to go to the doctor and to really get checked or to admit their stress. They'll just keep
For sure.
swallowing it.
I had a patient yesterday actually that we were discussing this, and he gets some digestive sort of stuff. I'm like, it's like, it's every time I'm stressed, but I don't feel stressed. I'm like, well, your body feels stressed. I'm like, but just there is a lack of recognition that it is. He's like, oh yeah. And then I look back and I go, yeah, okay, it's a stressful time in my life, but I don't register the stress. And I'm like, well, that's what your body's doing it for you. But yeah, it's really interesting that there was such a big disconnect around that. And I wonder if that's the vulnerability piece men are told, and maybe even it comes right back to caveman times where men couldn't be vulnerable because they get attacked by a lion. So they don't have that vulnerability piece genetically wired into them, because to be vulnerable like that is perceived as open to be attacked. Whereas, you know, women don't have that hardwired into them so much. So to say I need help or I'm struggling is easier for us potentially.
I can't tell you. I'm so glad that you said that, because I'd say about a year into my kidney disease process, I mean, my autoimmune process, right when my kidneys started to go downhill, I was very anxious. I was starting to have panic attacks. And I remember somebody said to me, like, you must be very, very stressed. And I actually said, no, I don't think so. I'm like, I don't like what's going on, but I don't really think I'm stressed. I couldn't even connect with how profoundly stressed my body was. It was like my mind was so used to how I grew up, trying to be in control and organizing things in my head in a safe way, that just like you said, I think I disconnected. I think I disconnected from this recognition that my body actually had been screaming at me for years. And I was just suppressing it or thinking it was normal, or just not even aware of what was really physiologically going on, And then what happened. And just in addition to what you were saying about sometimes men sometimes having a hard time connecting with this, is the moment I allowed myself to reconnect, it was like my heart broke open and I cried for days.
Yeah.
It was like I was avoiding.
Experience too. Yeah. Yeah.
Maybe it's like we know what's coming, so we kind of subconsciously like don't want to go there.
Yeah, for sure.
Right. The danger in that is when we suppress, we're out of balance. And if we're willfully suppressing, sometimes when you're unconscious to it, you don't realize, but you can engage in risky behaviors to cope. And we see this just in regular relationships as well, as like, well, then you're hiding and you're drinking, or you're doing drugs, or you're you're like running away to try to find some sort of sense of relief, because you know innately that something is just really radically imbalanced within you. And that's not healthy either. That starts to contribute to a really unhealthy cycle where it's turtles all the way down in a bad way. So,
Yes. Yeah, totally.
So how do we navigate? I wanted to bring that up. So some coping strategies that seem to work well for men who are under stress would be physical activities, problem solving approaches. That's something that helps them to, again, balance out their testosterone. It makes them feel good to try to problem solve and talk about it. And as we already mentioned, they may be less likely to seek emotional support. So if there's women watching this call and they have met husbands who are dealing with kidney disease, it's good to be aware of this stuff. If you see your man is really stressed and you know that he loves, walking or something, maybe encourage a walk rather than saying, you have to tell me what's going on, sit down and talk to me. It actually is a little bit, it's what we feel is right. It's what's natural and organic for us. But for your man, you want to try to, especially if they're under a lot of stress, encourage them to do what more innately supports their hormonal system, right?
Yeah. Yeah.
And again, for women, social connection, emotional expression. I've been in a relationship where, my man knows that I'm a little bit on edge, and he said, "You go to yoga class tonight."
Love it.
Because you can get triggered, but it is actually a very loving way for him to encourage me to go try to balance my energy out. So instead of being triggered and saying, "Oh, what are you trying to say here?" Just say, "You know what? You're right. I need to go do that," and usually come back feeling much better. So not being so triggered by our partners trying to help us. Self-care activities are really good for women. Reading, relaxation techniques, whatever, the salt bath, the art, the music, the cup of tea. When I was researching about the hormones, they were saying that for women, rebuilding the oxytocin is the biggest thing to help them navigate their stress response. And that mostly comes, and they said it's the hardest thing for women, but it mostly comes from them replenishing their own oxytocin. The man isn't going to necessarily do that for you. So they said the biggest challenge for women is to realize that they need to be the 80% provider of them balancing out their own oxytocin by self-caring. And it's so important for self-care for women. And, sometimes there's a narrative that says that self-care is selfish, or you shouldn't be focusing on yourself. You should be focusing on others. And actually, for women who are under stress, it's a huge disservice and misunderstanding to tell them that self-care is selfish, or they should just be focusing on the children and no one else, because then they are chronically imbalanced and prone to more stress.
Okay, interesting.
Yeah, and then women also are more likely to seek out professional help usually
Sure.
than men.
Yeah.
And this is the last slide. So just talking about supporting each other, I think is really important. Just to kind of, review this slide is understand where you fall on that spectrum. If you're a man or a woman, just take a good account of where you are. How do you handle your stress? How do you project your stress out onto others, your family, your children? Everybody hates to do that, or your partner. And then start to first work on understanding and navigating your own stress response, right? So if you're a man and you're getting stressed, maybe you say, you know what, I'm going to go play some golf tomorrow, or like try to adopt the appropriate methods to navigate your own stress response first.
Yeah.
And then I think you can start to realize once you're doing that, then you can add in the different dynamics with your family members and your partners. And once you get good at this, which when you develop your self-awareness, you'll start to be able to read this kind of energy in the workplace and other dynamics. You'll be able to see like, oh, well, that woman is very imbalanced feminine energy, or vice versa. But you don't ever want to say that to anybody, right? We have to accept where people are at. But it's such a wonderful tool to be able to keep men and women happier, to be able to communicate better, because we are so radically different. But at the end of the day, we really love each other, and we don't want to argue. We don't want to take our stress out on each other. So I just think it's a great tool. So I wanted to just share that with you today.
No, I think it's brilliant. And I think it's great that we actually cover the nuance between men and women when it comes to being diagnosed with chronic disease, and being able to, like I say, support your partner in a way that's going to be conducive to the nervous system. And speaking technically, because that is going to encourage more healing for that person if you can actually get them to regulate through the ways that are going to work for them. And it is different. And there is a bit of self-awareness or information about this floating around, but especially when we get stressed and when your partner has got a chronic disease and it causes stress for ourselves, this stuff can get thrown out the window, and we suddenly put our expectations on them and what we would do if we had a chronic disease, which is the big thing I think that I felt. I don't know when you were married if you felt this, but just how I think sometimes my husband would expect me to respond or work with having a chronic disease versus how I would naturally do it myself. And it's just because they're stressed as well. And then you get this cycle going of two people trying to manage it different ways. So I think that's really good information to remember, that when our partners are diagnosed with a chronic disease, they're going to navigate it differently to how you would. And your way isn't necessarily better for them, because you need to work with whatever will regulate their nervous system to allow healing.
Yes, being ill, you're absolutely right. Being ill is enough of an issue. Don't feel good. So again, there is a little bit of a learning arc here with this kind of stuff, but it's well worth it, because like you said, if both partners are stressed, it's going to make the whole entire journey, including your health. You may have more health complications because of this chronic stress, right? So they say that chronic stress contributes to, such a large percentage of diseases. We don't want anything else happening. So nobody really talked to me appropriately about navigating my stress. I had very few options, that were offered to me at the tender stages of my first diagnosis when I was young. Again, I was just told you're going to have a ton of stress, and it's best just to consider taking an anti-anxiety medication. And I'm not saying anything bad about it. I had to do it when I was on dialysis briefly. But what I'm saying is there are so many holistic tools that literally could make our life better, not just around illness, but could literally make our relationship better and our life better if we just took a little time to educate ourselves. And sadly, a lot of the healthcare system is focused on the very important role of, the tech part of it, the surgery part of it, the dialysis part of it. But when it comes to holistic health, it's just really absent. So this kind of work helped me in my illness experience as I became aware of it, but then has completely transformed all of my relationships. And after my second transplant, has been such a critical tool to keep me balanced, to understand myself that way, and to understand other people's energy and stress responses, and how I best can not just support myself, but to support the people I love as well.
Yeah, no, I love that, Stephanie. Thank you for sharing. And it's such an important conversation to have with the people around you, family members, children, parents, anyone that's trying to support you through a journey of chronic health, by being really clear about and getting in touch with yourself about how you deal with chronic stress yourself, and letting people know how they can best support you through understanding the differences and nuances between men and women and how we potentially go about things. So I think it's a great conversation starter. So if
Hey, you know
anyone
what?
wants, Mhm.
I just wanted to say one more thing
Yeah,
that's important is that I see so often throughout my journey with kidney disease where somebody that is going through the illness process, they feel disempowered and they feel like nobody understands. They get very depressed and they'll say, well, my husband expects me to do this and he doesn't understand and my family doesn't understand. And patients can start to feel very alone because they feel like they're very misunderstood. And the reality is there is a huge gap of understanding. So I just want to encourage people who feel like your family doesn't understand you, your family's not giving you what you need, your family doesn't know exactly what you're feeling. And this was a big wake up call for me along my kidney disease journey. Was it matured me a lot. It really made me realize, well, how could I expect my family to understand what I'm going through? They're not going through it. So I had to be a little more graceful and lower the expectations a little bit with my family instead of trying to assume that they knew what I needed and they should understand. And what I did was I started to seek out people who actually had that experience or people that I trusted that I could connect with. I can guarantee almost everybody is that you're not going to get the exact understanding from anybody in your family. So don't
no,
even expect it. They're doing their best. They're caretakers and often very stressed themselves. Often they're doing the best that they can. Sometimes they're not, and relationship issues can happen. But please don't expect your loved ones to be there to just read your mind and understand all your expectations. Do your best to communicate what you need. And if you're not feeling good or you need more support, try to find somebody who's lived it because then they can really meet you where you're at.
yeah, no, it great advice, and I think that's really important, and that's the amazing role that you provide to people, right? Because it's not like you're an outside counselor or psychologist sitting in, it's often my thing. I'm like, well, how can a psychologist or anyone I'm talking to really get it because they've not lived my experience? But very different for people going through dialysis or kidney transplant or even lupus in its own self. It's like, no, you've lived and breathed this not once but twice, and how to navigate that. So I think that's what makes you such a valuable asset to the Kidney Coach team and to anybody that you work with, because it's more than empathy. It's a deep understanding of what people actually feel. It's a step beyond being empathic. It's
You're
lived experience.
being like seen at the deepest levels because
Yeah.
somebody else has the lived journey. And that's truly what we want when we're feeling sad, when we're feeling lost and confused, is we want to be seen and met where we're at. And somebody who doesn't have that lived experience, they can take you so far. But if you're really suffering, for me, it's just I can look at other patients in their eyes. And literally, it's like an immediate, like, I see you at your deepest level. And that's very supportive and very healing.
Totally agree. There is, I think, being seen, especially by men, actually. I think I read a study very recently that being seen is very, very, women, because they can do the connection and sort of, because as you mentioned, the brain can understand that people maybe not be able to see at the exact same level, but men being seen in that way is very, very, very important. So I love that.
Yeah.
So if anyone's out there listening to this thinking, actually, I'm going to put my hand up and I need some support, I'll put a link below how you can connect with Stephanie and get some really specific guided support if you're going through kidney disease, if you're looking at having to go on dialysis or you're on dialysis or transplant. She can help with the whole gamut of any chronic disease, but those as well. If you want to know more about Stephanie, I'll put in a direct link to her website as well, so you can read about her history and all the amazing things that she does and that she has to offer. She works with people all over the world, so even if you're outside of the USA, she can definitely help and support you. If you want to know more about what we do, head to www.kidneycoach.com, and you'll also find us on Facebook and Instagram and probably other places that I'm not even aware of. And finally, remember to hit like and subscribe. That way you will get notified anytime we put up a new YouTube video. Or if you have any questions specifically for Stephanie, please put them in below and I will get them to her. And if there's any particular topics that you'd like Stephanie to address or talk about, reach out and let us know. She is a regular guest on the YouTube channel, so she'll be more than happy to put one of her amazing presentations and thoughtfulness into it, and we can definitely discuss it. So don't be shy, put in any suggestions below. Stephanie, thank you as always for being you and pioneering the way and taking what you went through, which, you know, people could look back and go, that's horrendous, and switching it into being able to shine a light for other people. It's a unique gift that you have and a contribution to the world. And we are very grateful that you crossed paths with us and we get to snag you and steal you onto our team. I love it.
Oh, me too. Thank you so much for all you guys do. And for anybody watching, thank you for taking the time to listen and to take more of a holistic approach. It's definitely worth it.
Totally. Thank you for being part of our community, and we look forward to talking to you next time. Bye.